Today, we are going to answer your questions about where to find a list of covered drugs, what to do if your medication is not listed, how to subscribe to 90-day prescriptions, and where to find an in-network pharmacy. Let's talk about where you can find a list of preferred medications. Preferred drugs are available brand and generic drugs that are approved by the Food and Drug Administration and covered through your Ambetter prescription drug benefit. To find a list of Ambetter preferred drugs, go to ambetter.magnoliahealthplan.com and click on For Members. Then scroll down and click on Drug Coverage. You should see this page, Pharmacy Resources. The preferred drug list is an electronic document you can access right here. The document should open and look like this. Instead of reading through the entire formulary, scroll down to the index. You can look for your medication on the index and go to the page number found on the document to see the drug name, drug tier, and requirements. To find out what tier levels mean, go to the formulary introduction at the front of the document. The drug list key explains each tier level. Tier 0. No copayment for those drugs that are used for prevention and are mandated by the Affordable Care Act. Select oral contraceptives, vitamin D, folic acid for women of childbearing age, over-the-counter aspirin, and smoking cessation products may be covered under this tier. Certain age limits apply. Tier 1A. Lowest copayment for those drugs that offer the greatest value compared to other drugs used to treat similar conditions. Select over-the-counter, generic, or brand name drugs may be covered under this tier. Tier 1B. Low copayment for those drugs that offer great value compared to other drugs used to treat similar conditions. Select over-the-counter drugs may be covered under this tier. Tier 2. Medium copayment covers brand name drugs that are generally more affordable or may be preferred compared to other drugs used to treat the same conditions. Tier 3. High copayment covers higher cost brand name and non-preferred generic drugs. This tier may also cover non-specialty drugs that are not on the prescription drug list, but approval has been granted for coverage. Tier 4. Highest copayment. This is for specialty drugs used to treat complex chronic conditions that may require special handling, storage, or clinical management. Prescription drugs covered under the specialty tier require fulfillment at a pharmacy that participates in Ambetter's specialty or hemophilia networks. For additional information on which pharmacies are within our specialty or hemophilia networks, please consult Ambetter website's Pharmacy Information section. If you do not see your medication on the drug coverage list, your provider will need to fill out a prior authorization form found on the For Providers page under Drug Coverage on the ambetter.magnoliahealthplan.com webpage. It can take up to 72 hours to receive a response on a prior authorization. If the request is not approved, the notice of disapproval will contain a clear explanation of the specific reasons for disapproving the prior authorization request. Or, if the request was incomplete, the explanation will identify the missing material information that is necessary to complete the request. 90-day prescriptions. As an Ambetter member, you can maximize your pharmacy benefits by filling your prescriptions with CVS Caremark Mail Service Pharmacy, the only in-network mail-order pharmacy. Eligible members only pay 2.5 times their regular copay for a 3-month fill. Delivery is free and can be to your home, workplace, or any address you choose. Prescription delivery may be right for you if you take medications regularly for conditions like high blood pressure, arthritis, or diabetes. Why? 3 refills in 1 prescription. Lower cost per month. Fewer trips to the pharmacy, which means fewer chances to run out of medications. Some easy ways to get started. Call your doctor and ask them to send a new 90-day prescription to CVS Caremark Mail Service Pharmacy, or request a new 90-day prescription at caremark.com, or call Ambetter Member Services at 877-687-1187, Relay 711 for the hearing impaired. How to find an in-network pharmacy. To find an Ambetter partner pharmacy, go to ambetter.magnoliahealthplan.com, click on For Members, then click the Find a Doctor link. Here is the Select a Network screen. Click this button if you have an Essential, Balanced Care, or Secure Care plan. If you have a Virtual Access plan, click here. Be sure to click the right button because the networks are different. This is the main search box. You can type pharmacy and enter your city and state. Click search and the site will autofill with some of the most popular search results. A wide selection of pharmacies will appear. You can check their hours and get directions. Thank you for watching this video. If you need help, please call Ambetter Member Services at 877-687-1187, Relay 711 for the hearing impaired. And if you need to make changes to your Ambetter insurance or have friends or family who need coverage, you can shop on the marketplace through enroll.ambetterhealth.com or speak with a local Ambetter insurance broker. Just go to ambetter.magnoliahealthplan.com. Click on Our Health Plans, then click on Find a Broker.